My name is Francis Iula, and I'm with Chiefy. So I work for a software company. We developed some AI. In my previous background, I was in medical device for about 10 years working at NYU, implementing, yeah, all right, we got some NYU. We were implementing the robotics program there. So any of the spine robots, that's what I was doing in my previous career, and went over to software. And what we're trying to do is we're trying to bring software and AI and make it not scary. Like software and AI should not be scary for people, even though everyone's running away from it. It seems like, but it's a very good tool, and I think it's a great tool, especially for the folks here, because you guys are the leaders, right? Literally, you guys are going to go home and you're going to go back to your institutions, and it's going to be your job to start implementing some of the ideas that you've seen here. And this is what I want to talk about and why it's a good co-pilot for you guys to do that and to introduce yourselves in a very easy, practical way to make real change in your operating room. So why is there French toast on the screen? Great question. The reason why there's French toast on the screen is because I love French toast, first of all, but I was in the south of France this past summertime when I was thinking about this presentation, and I was like, how am I going to bridge this gap? And I had this delicious French toast in front of me. And I obviously don't speak French, and I wanted to figure out how I could get this recipe, from the chef. I didn't want to approach him, so I thought maybe I'll use ChatGPT to do that. So I went back home with the experience that I had in my mind, and I outlined it to ChatGPT, and I said, look, I had this great French toast. It was in this area of France. It was, it didn't have any cinnamon clumps on it. It was just like the perfect French toast. I put that in the ChatGPT, and what it popped out was a recipe that then I was able to emulate what a French chef was able to provide to me. It was the same thing. And I thought to myself, wow, if there was a guideline to how I can do this myself, essentially create something that a chef could create, could we do that in healthcare? So when Nyleen and I started talking, we started experimenting and taking some of the guidelines that come from AORN, that come from JCO, and we started saying, like, is this practical? And we started experimenting. This is exactly what we're going to be showing you guys today. So again, that's me. Without further ado, I'm going to introduce Nyleen.
Hi, I'm Nyleen. I am the executive in the room, and I will be speaking from that perspective. So I'll be the boring one in the room. He's the fun one. Yeah, I've been in healthcare for about 16 years, and for the last 4, I have been a CEO of a surgery center. And I also just transitioned to be the administrative officer for an orthopedic practice in Georgia, which just opened up. And so we're running into a lot of things, being a new practice, moving from one state to another. We're running into a lot of issues with our ORs and our different hospitals. So this is really timely and has really helped us develop this presentation. So that's kind of our background and how we got to work together.
Yeah. I want to talk about the current state of surgical safety.
So the current state of surgical safety. So what's going on in surgery today? Well, obviously, there's always a room for improvement, right? We always want to make things better. And how are we want to make it better? We want to make it safer. We want to have quality of care delivered to our patients, especially now that everything is moving to these value-based models. We want to make sure that patients are satisfied, the doctors are happy, the staff is happy, And so we also want to improve the ways we run our ORs. And that means you have to improve your processes, you have to improve efficiencies without risking the quality and safety. Now, I walked around and the presentations, by the way, your quality presentations were amazing and were great. So we know that there's things to work on. The other thing is time is money. As an executive, I'm looking at the bottom dollar. Every minute that my OR is empty is money that we are losing. And if I am not filling it, and if it's taking too long to clean or to turn around, or my block time is not being utilized, I'm losing money. New staff turnover. So in the surgery center space, we were losing nurses left and right because the hospitals are paying them 10, 15, 20, $30 more an hour than my little ASC. The only thing I could offer was, well, better quality of life, Monday to Friday, no call, sounds pretty good. The other problem is admin constraints, right? So me as an administrator, I'm gonna tell you, oh, you wanted to use that anchor? Yeah, no. No, I don't have a contract with that vendor. You're not using it. And the surgeon's like, I'm gonna do whatever I want. That's another problem, right, that we face. Contracting and payer limitations. So the insurance is telling us what's bundled, what's not, what is reimbursable, what it's not. In a surgery center, it's to the penny because we're not getting reimbursed for our implants the majority of the time. So it's very, very difficult right now. And communication pitfalls, I think, is the number one, right? So you have a new surgeon, he comes in. I used to work, when I worked at the hospital, I'd have new surgeon, okay, we're gonna tour the OR, great. And so this is our OR director, great. Okay, so can I have your preference cards? He's like, yeah, I'll just use Dr. Smith's. And it's like, really? So communication, right? So we know that this is a serious problem. We have new doctors, new kids coming out of school now are using very different things than our older surgeons. So all of that is creating a big communication kind of gap in our surgical area. And then safety, right? So we're gonna talk about a little bit about safety in our next slide. And adverse events. Surgical adverse events are the second most common, right? And are life-threatening. So adverse events in the OR happen because it's a high stakes environment. People are at their most vulnerable, right? We are taking care of them when they don't know what's being done to them, right? And so we also are dealing with people who are irritated, people who may be upset because their manager yelled at them, doctors who may be having marital problems, you know, people who are late, people who are early. There's all these things going on, and yet we have to deal with it. We have to deal with the communication pitfalls. And so the other thing is the industrialization of healthcare is a problem, right? Because they still got to meet the numbers. The doctors still have to make the numbers. They have to meet all of these things, and yet the 2% that Medicare is giving this year is not the 2% you're getting in your paycheck, right? So all of this money has to be allotted some way. So streamlining and maximizing resources is what we want to get to. So we got to work with what we got. We know the system needs a lot of help and there's a lot of things we can't control. So we're going to talk about how AI can maybe get some of these problems and we can use them some way to solve some of these problems you guys have on this beautiful boards outside.
So yeah, well said. And I think a lot of the things that Nyleen was just talking about are actually some of the things that probably you guys hear in your institutions from admin folks. They might refer them to as low-hanging fruit. I don't know if you've heard that before, but that's what they're talking about. The things that Nyleen just said, and the things that you're nodding your heads about. That yeah, this is relevant. This is what, you know. These are the goals of the institution. These are the low-hanging fruits. That's exactly what Nyleen just kind of went over. So how do we then turn this into something actionable? Well, you know, my opinion is that AI can help you do that. The students aren't going to come in and they're not going to, you know, they'll tell you. And I love it because you know, you have the PCAS report here. These are pretty important documents, but all of these documents that come out, it's always funny. You know, if it comes from JCO or, you know, as high up as the president of the United States, they tell you what's wrong, but they don't really say how to do any of it.
And they don't want to pay for it either.
And they don't want to pay for it. So you're stuck in between this rock and a hard place. And by the way, you have a ton of patients that you need to take care of. And, you know, the point of this whole conversation is, how do we empower you guys to then actually, you know, present your posters? Let's not leave them there, right? Let's turn them into actionable things that you guys can then scale. Like, I'd love to see, there was a great poster out there about preference cards. The poster said 50% of preference cards are wrong and 50% of the instruments on the instrument cards are wrong. So that's 100% right there. You're walking into 100% of the stuff that you need for a case. How is that possible? If you went to any other job, if you went to a construction site, you had nothing there to complete the construction.
You forgot your hammer.
Right. You came with the wrong tools. What's going to happen? And we're doing that. We're treating our patients this way. It's not that, the people on the floor are treating the patients that way, but it's the systems that are put in place that aren't helping you do your job. So how do we bridge this gap? And by the way, it is a national agenda. It's on the national agenda, right? This PCAS report, I'll send it to you and post this talk here, but it's important. It's gone all the way up. And what it's talking about is there's an urgency for this. That we clearly laid out some of the gaps and safety protocols, and it's saying, again, it's not saying how, but it is saying that there is AI there. We need more data-driven decision making, and we're trying to offer a way forward. We want to turn all these projects out here into scalable solutions. There's a lot of really great ideas.
And there's a lot of ways that companies are using AI now. And there is a company out there who will be launching in the next year, probably, an OR AI robot cameras in the OR. And what it's going to be doing is it's going to read a surgeon, learn a surgeon's procedure, and it's going to connect with the computers, with the screen on the thing, and it's going to tell the scrub techs to the minute what is going to happen next, what instruments will be needed for the case. So it's going to live learn each doctor's way of him doing that procedure, because obviously a shoulder scope is not a shoulder scope is not a shoulder scope. Everybody has their own preferences. So it's going to be able to read the monitor, right? Read the room, learn the surgeon, and hopefully use AI to reduce OR time to the minute. So know exactly how long. Yeah. I can't disclose that, but they gave that to me for the presentation to let them know that they're working on it. Yeah. It's okay.
Is that something that in the future they're looking to replace across oceans where we're working in one OR trying to teach surgeons that are doing a procedure in another country?
I didn't even think about that.
Yeah.
Probably. I mean, why not?
There's a lot of that.
It's going to learn everything.
There's a lot of that that's happening right now. The problem with communicating across seas isn't actually the technology that's available. It's not the current AI that's available. It's the internet.
Yeah, sorry, Mom. Mm-hmm. Right. Correct. 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 It's gonna. Correct. Because it's gonna learn per surgeon, per case. Yeah. Correct. Right. So exactly. So those are the things that they're going to have to work out, and that's how AI is going to learn.
So that's actually what our company does.
Yeah.
That's what my company does right now. We can talk about it after. It's not a commercial discussion, but if you'd like to talk about it afterwards.
Right.
This is what we're doing.
Right. Is knowing what the patient needs before they're in there and communicating that.
And what we found is that there really aren't as many snowflakes as we think. And I think it's mostly because healthcare is still so silent. But let's have a talk about it afterwards. But this is where it's going. And I wanted to show you something. This slide really quick, really here. This slide real quick here. SaaS isn't a disposition. It means software as a service. And I had to explain this a couple weeks ago to we were working at NYU, and somebody said, "What is SaaS?" And the point of that bringing this up is that this is an industry that healthcare for some reason missed, and it's been around for the last 20 years. And the comparison between the investment between SaaS and healthcare and SaaS in general is staggering. So we have a lot of ways. We have a long way to go until our software catches up. to what everybody else is using. And it's a little bit scary because we are really far behind.
Well, yeah,
HIPAA is checkboxes. And if you work with
and verbiage.
good software people, HIPAA is easy to get around. It's not a get around is the wrong word. To check off the check boxes.
And to ensure that we're compliant.
And to ensure compliance.
But what he's
Yeah.
talking about is, let's just right here in this room, we'll name 2 names. Who's on Epic and who's on Cerner? Who's on anything else? Okay, so we've got 3. And what are some of the other ones? Oh.
Okay, but yeah.
Oh.
Yeah. The point of actually what she was trying to say is are any of them not billing software?
Are any of them not billing softwares? Just charting? Just charting?
Okay, we can get into it.
Yeah.
Anyway, this is the point I'm trying to make, because there's a long way to go, and the hurdles aren't that hard to get over. You can do it. The problem is the talent goes to where the money is. Right. Okay, so we're going to do a little exercise with ChatGPT. We're going to make it fun, and what I want to tell you all is that AI is not scary. It's exciting. It's fun. The more you work with it, the more you'll understand it, and the more it will understand you. It is a $20. I'm not selling ChatGPT, but it's a $20 subscription. It is the best $20.
You can get it for free though.
There's a free model. There's a free version. It's the best $20 I've ever spent. If you're somebody that likes to problem solve, do it with ChatGPT. It's a great co-pilot, and it can really, really, really help you present anything. So let's see what AI can learn from you. So on your tables here, you have numbers, and I'm going to get my.
If you don't have one, I'll give you a little.
You don't have a number. I made 30. If you don't have a number, I want you to remember your number.
And the goal is we want to capture relevant data to help
get a number?
increase. Yeah.
Get a number here.
Oh, we didn't get a number? We got extra numbers. There's some on the table.
You don't
need a number.
No.
Who's going to, you can share
you can
ideas.
Share one. Here's the thing. I'm going to randomly pick out a number, and then you're going to come up and you're going to present with us. So if you don't want to do it, stay out. But it's going to be fun. So I'm going to also, if we could all scan this. If you can't see it, then I'll come to you. Okay, I'll come to you guys. Just let me know. It's a little questionnaire.
And it's basically,
Yep, I'll come this way.
What is something that we want to capture relevant data to help increase your revenue, enhance your OR, interoperability between every department, and increase patient safety. So something that irritates you and you want to fix it and you want to describe something about it.
Yeah, I mean, it's the low-hanging fruits that I was just talking about. Everyone's probably got some low-hanging fruit goal that some admin probably said we have to accomplish this year. I want to know what that is. And I want to see if ChatGPT
can give you a step-by-step on how to
can
fix
help you achieve that goal.
So we have to pick one goal for next year?
Yeah.
One goal, yeah, for your institution. Yeah. Yeah.
Yeah, one goal that you would like to achieve. And I'm going to give you a cheat sheet. I'm going to say one. I want to improve communication between pre-op and my pre-op nurse and my circulator. I mean, that's just one for me. Something like that.
How are we doing on time? Oh, good. We're good.
We're good. They told us the party starts after this, so we got to hurry up.
Yeah.
So
Sorry, we get, what was it?
You're supposed to choose your own. I
No,
said
no,
pre-op.
you had a good one.
Mine was, my goal is I want to have my pre-op nurse and my intra-op nurse to have better communication on orthopedic surgery cases that involve patients over the age of 65
Yeah.
and have a history of being on blood thinners. It is because I want a specific problem solved. That's what we want. We want to have a problem, right? We're not,
Yeah, the whole point of the
is one stare at a time, right?
the exercise. Yes, one stare at a time.
One stare at a
The whole
time.
point of the exercise is we're gonna find, we're gonna read some of your goals, and then we're gonna do some prompt engineering. It's called, which is a fancy word of saying I'm gonna talk to AI. Yeah, exactly. And we're gonna put AI on it. It's gonna be you that's climbing the stairs. No, just-
And our goal is to, you guys have this and take it back to one of your leaders and say, I came up with this plan. Let's put it as our next PI project.
Yeah, like go home, change the world. Like this is the power. Yeah.
The goal has to be specific, not broad.
Yeah,
Right.
you want it. So when you're thinking about it, yeah, not superfluous, but like,
Want to yes, give you another example. How are we doing? Good? You think we have
Yeah.
ideas?
all right. So I'm gonna come around and collect some numbers, and then we're gonna randomly pull them out of the.
So do we all have to have?
No, whatever you
no,
want.
no.
Whatever
Yeah.
makes.
I'll give you. How about 2 more minutes?
Okay, we got, yeah.
Get some stragglers.
What?
I need
Yeah,
stragglers.
for stragglers. And to your point, there's another company out there who's actually here in Connecticut. I met them at Becker's last year. He invented for neurosurgery a machine that in order to do fusions, a big problem in neurosurgery is they're being done on the wrong levels apparently, right? So how can AI help with that? So what they did was he invented a machine that uses CT, not fluoro, uses CT, and what AI is being used
the number
for
on the back?
is in pre-op, they do a scan of the patient
Remember the number?
and they do a virtual twin of that patient in the OR. And then the machine actually learns, watch out. The machine actually learns the patient, the anomaly of that patient, of that case, and that AI will be brought forth and it will actually have live suggestions and will actually know where to place the machine to actually work on the patient and how to work on that patient. Because it's already learned what it needs to do for that particular patient, and it's done under CAT scan and not X-ray. So it's really interesting how different software companies and different machines are using AI to improve patient safety. So those are 2 companies I've run into.
Don't forget the number, okay? You guys are twins? Oh my God.
Oh.
You don't have to put it, if you don't want to play, you don't have to put it in.
All right, we're at 2 minutes,
No, you're
Fran.
gonna write it on that QR code. I'm sure it wasn't. That means any cards back here? No? No. It's gonna be written in here. Yeah?
I didn't put 12 in yet.
What's that?
I didn't put the number.
No, that's okay. Yeah. As long as I have just and you submitted it. Okay.
All right, Fran, we're at 2 minutes.
Okay, sorry. I was having fun back there.
Yeah,
All
I'll be the executive in the room. It's time to go.
Yeah, perfect. Okay, so what's left. I'm picking a number randomly out of this. I'm not cheating or anything. I hope we're gonna have fun. It's gonna be fun. Okay, I got it. Number 30. All right, come on up. Let's see. You can stay there too if you want to. Okay. All right. So, do you want to tell? You could tell me, and I'll
Do your
remind the
thing
crowd
here.
what your goal is for next year.
Cases in the OR, because 25 minutes is a goal.
Okay.
What kind of case? Any case?
So,
General surgery. General
Okay.
surgery oncology cases.
and so, what's your role in the OR? So, I am a surgical technologist. How big is your?
OR, surgery center, or 18 rooms, 18 general surgery, ORs? Okay.
We primarily do general surgery, and next year we want
To decrease our, you said increase or decrease? Decrease. 28 minutes. Decrease our OR turnover time. Two table setups. Big cases.
Livers and pancreases.
You want to get it to 25 minutes? Okay.
The surgeon is dictating that last case, so he's not coming.
Is there any, are there any, anything you want to reference? Like we could do like,
We have two, you said it's 2 tables. We have 2 surgical tables. So I would say we have 2 surgical tables. And how many?
That's okay. That's okay. What I'm curious is there any like, we talked about JCO, is there anything? that
Oh,
we like-
who's your regulatory body? Joint Commission? You're Joint Commission accredited for a Joint Commission accredited facility.
And so this is how you, this is, you know, this is prompt engineering. And what it's doing right now is it's basically scouring the web based off of all the things that we're talking about. And it's giving you, you know, ideas as to how then to go and take this stuff and bring it back to your operating room. And now I would assume that then you would go and talk to somebody who runs the operating room and you say, look, I have this idea, I want to do this. What do you think about my plan that I came up with Chat? You don't have to say you came up with ChatGPT. Right. But the point is that most people aren't doing this right now, and I think most people don't understand that this exists. And this is nothing to do with patient information. This is some of the low-hanging fruits that I'm talking about. This is going to directly impact your hospital, and you're going to be responsible for making, you know, your life better, essentially, and the people that come to your hospital, whether they're patients or employees, their lives better too, because now you have some structure behind some of the goals that the institution wants to implement. Yeah.
Shared publicly on platforms that some of the chat GPT information has come back with all these information.
Yeah. Yeah.
So how do we know that some of the information that is coming back is outside of clinical knowledge?
You're the-
that we have, that it's good, usable?
The beautiful thing is that you're the expert. And the reason why I didn't want to lead with how ChatGPT is going to revolutionize the world of healthcare is because it's not. You're
It's just
going
a
to
tool.
determine what's going to revolutionize healthcare. Yeah, and I think that this is the hardest part, I think, for people who are practicing is not having enough time to sit down and write a checklist and come up with this stuff. If it says like throw a pizza party, like you're not going to throw a pizza party, right? And if it said throw a pizza party, you can then have a conversation with it and scold it a little bit. I'm serious. And you can say, this is not the goal that I'm trying to achieve. Like I don't want, people eating pizza. I want them, I want to know, I want to know based off of best practices and what JCO says, like how I can do that. And it will reference it. And you can ask it for references and it will help you build that presentation so that you can then go ahead to whoever your boss is or their boss's boss and say, look, this is what I want to do, or this is what NYU is doing, or this is what HSS does. And you can tailor it to your institution. Like a lot of the things that I hear that are out there now, it's like, don't compare a small surgery center to HSS. Why, right? Like, what if I said that, if I asked ChatGPT, what does HSS do? And then how can I tailor it to my surgery center? Here's what my surgery center is. Give me a plan. And it'll lay that plan out for you. The point is that, and I think that this is the hardest thing for me going from rep world to software and building software, was understanding that software is iterative. Unlike anything else that you do in your life right now, in terms of healthcare, software is meant to be built to be constantly learning and improving. And the more you understand that, and the more you engage with tools like this, the easier your life will become. That's what software is.
And practice makes perfect, right? So
Yeah,
going
sorry.
back to our slides, it's that it will continue to learn the more detailed you get. Obviously, we can't know every single standard. We know that every infection prevention standard is going to change. That's why there's different certifications. That's why a CNOR does not mean you have your CAIP certification. That doesn't mean you have your thing. Each one has its own level of profession and its own level of expectation. So we're not telling you to be the experts. We're trying to say, this is how change is made. And this is your way to present the change and make some kind of impact in your institution.
Yeah, and that's the goal. It's like I always get a little I lose a little bit of motivation every time I come to a conference because I see all of the great work that people do. And I think to myself, man, like if only we can scale this stuff. Like how do we scale that preference card presentation in the back? How do all these presentations that are out there can all be scalable? And all the things that you're working on can really affect so many other institutions across the nation. And the point of the PCAS, the urgency behind healthcare leaders going to the president and basically saying, look, like we need this at a national level. That's the point. Like we need this at a national level. And the people that are in the room right now, you're the people. And I think the gap is you have busy lives. So like, how can you implement the things that you want to implement when you have families, when you have work projects and things like that, and everyone else is a million miles an hour going in other directions. This is a really good tool to do that. And
so he put best practices here for prompt engineering. It's okay, I'll keep you on track. These are some things that you guys can use. This is how software ideas happen. It says, we reviewed an article that came out and it was, I hate doing this. And as a result of that, then that's how Uber was formed, and that's how Dropbox was formed. And that's how all of these things happen, are to improve our processes overall.
yeah,
So AI and the future of healthcare is, we hope that it helps us meet our goals. And obviously it's to make surgery safer. like my main doc says, he's like, the OR is sacred. It is the most sacred ground in a hospital because, again, patients are at their most vulnerable. And so AI can help you make actionable, measurable byproduct. Okay, because the reality is we all held to KPIs. We all want to improve. And if you guys are leaders, that means that you're taking actionable steps to improve yourself and improve your institution. And you've made that commitment. So AI can help increase efficiencies and have a financial impact in your center or your facility or your OR or your room. Because for every minute of turnover, you're right, that's more money, more increase in efficiency. You're going to have physician and employee satisfaction, so hopefully improving communication, getting those preference cards to 80 instead of 50%, correct? And being picked correctly is a very hopefully thing. And you're going to have quantifiable data for the executives so that we can have actual data from GPT, because we love words. So you say, okay, this is my problem. These are the steps that I have it. Can you help me achieve that? And how you got that checklist, they don't have to know that you use ChatGPT, you know? You got together with your teammates and you worked hard to solve this problem, but it gives you actual data. So that's how AI can really help you and is going to help the OR. And then it's Fran's favorite slide next, unless you have something else you want to say about that.
No.
That's the recipe.
Here's the French toast recipe. So I did have, if you guys did submit your QR codes, then I have your emails and I'll send you guys the French toast recipe. Obviously, and then some of the literature that we talked about in the slides, it's really just I would read the PCAS report. Even if you didn't put your email in, go home and Google it, read the PCAS report. It's on the national agenda, and they need people to be doing things in order to solve these goals. It's important now, where so we don't want to be in a position where we miss this next phase of software. We missed that SaaS. We don't want to miss this, and you want to be experts on it. Because it is coming, and you better know what you're talking about, because we don't want it to take over the world, right?
Right, and it's not going to take over your jobs.
Yeah.
It's not going to take over, right. So you can't ever replace the tech.
You
No,
still need people,
but you need people.
It can give you
Correct.
ideas. Yeah, it can give you.
Yeah.
Go ahead. Yeah.
Well, there's an opportunity there for not only some of the conversations we've had here, but for opportunities of one project that I'm doing at my facility is that we are now determining if a patient has propensity for aggression.
Yeah.
So
Yeah.
we're utilizing that to create a safer environment for our staff.
Yeah, I had a patient wake up from anesthesia and bite my nursing director because she came out so out of it. It took us almost an hour to calm her down and to get her out of that mental state. And that was a huge problem because we had an injury, we had to get workers' comp, we were potential law. I mean, it was a big problem. So that's a perfect way to use that. Mm-hmm.
Anyway, guys, thank you so much. If there's any other questions, we do have 8 minutes, but